this video, we will explore vaccine administration and prescribing by pharmacists, looking specifically at the scope of services they offer, their training, and the impact they're making in communities. Today, in 2024, pharmacists in 44 countries are authorized to administer vaccines, compared to only 13 countries in 2016 as reported by the International Pharmaceutical Federation (FIP). This demonstrates the growing acceptance of pharmacists as key healthcare providers in public health efforts, particularly in vaccination services. In this video, we will examine pharmacist-led vaccination models from 7 countries: Australia, Canada, France, Ireland, Portugal, the United Kingdom, and the United States of America. Each country provides unique insights into how pharmacists contribute to public health through vaccination. Let's start by looking at Australia. Pharmacists, along with other healthcare professionals, although not pharmacy technicians, are authorized to administer vaccines. Importantly, pharmacists have full access to vaccination records, which means they can view the complete vaccination history of a patient, including all vaccines administered across different healthcare settings. This access integrates data from physicians and national vaccine registries, providing a comprehensive overview of a patient's immunization status. Pharmacists are required to report all vaccines they administer to the Australian Immunisation Register, preferably within 24 hours but no later than 10 business days. Accurate and up-to-date records of vaccinations must be maintained by the administering pharmacist or pharmacy. To better understand the pharmacist's role in Australia, let's hear from the Pharmaceutical Society of Australia.
Any vaccine can be administered by a pharmacist if they are competent, except in South Australia or in Tasmania. In Tasmania, a limited list applies. When it comes to the prescribing and administering of vaccines, pharmacists can administer most routine vaccines to people over the age of 5 years. This includes influenza, COVID-19, HPV vaccine, shingles, pneumococcal, for example. And some more recent examples that have been added to the list include rabies in New South Wales, some travel health vaccines as a pilot program in Victoria, Mpox in Victoria, and RSV vaccine in most states and territories of Australia. The list varies substantially between different states and territories, and the age groups do vary as well. In Queensland, for example, there's no age restriction for influenza vaccines, where in other states there's quite specific age and location restrictions. This provides substantial program complexity and is a key role for PSA as a member body to support pharmacists in Australia in understanding their legal and professional obligations.
Some of the selected vaccines administered by pharmacists in Australia include influenza and COVID-19, hepatitis B, HPV, meningococcal and pneumococcal, shingles, and Tdap. Since 1st of May 2024, pharmacists in New South Wales and Queensland have also been administering and prescribing RSV vaccines. According to recent guidelines published by the Australian Pharmacy Council in May 2024, additional vaccines may be approved for administration by pharmacists, varying by region depending on local regulations or provincial state laws. Pharmacists must follow professional guidelines such as the Practice Guidelines for the Provision of Immunization Services by the Pharmaceutical Society of Australia, or the Guidelines for Conducting Immunization Services within a Community Pharmacy Environment by the Pharmacy Guild of Australia. All of these vaccines can also be prescribed by pharmacists. The list we focus on in this video will showcase the broad scope of their prescribing authority. Pharmacists in Australia must complete accredited training approved by the Australian Pharmacy Council, which includes certifications in anaphylaxis management, cardiopulmonary resuscitation (CPR), and first aid. These certifications require regular renewal, CPR annually, and first aid every 3 years. Vaccination training is available at both undergraduate and postgraduate levels, with efforts from organizations like the Pharmaceutical Society of Australia to standardize training across jurisdictions to ensure consistency. For the eligibility criteria to become an approved service provider under the National Immunization Program Vaccinations in Pharmacy, the NIP-VIP program, which offers free National Immunization Program vaccines at community pharmacies, scan the QR code. Pharmacists have made significant contributions to public health in Australia. For example, during certain periods, pharmacists administered 50% of COVID-19 vaccinations in some regions. And between March and May 2024, pharmacists provided 24.4% of flu vaccines, up from 15.7% in 2021. Now let's move on to Canada. Pharmacists, pharmacy technicians, and other healthcare professionals can administer vaccines. Pharmacists have partial access to vaccination records. Partial access to vaccination records allows pharmacists to see only those vaccines that the patient has received in pharmacies, for example, in their specific chain of pharmacies. This type of access does not include a full history from all other healthcare providers or from the National Registry, thus providing a less comprehensive view of a patient's vaccination history. Similar to Australia, Canadian pharmacists can administer a wide range of vaccines. As we can see, the administration and prescribing authority varies across Canada based on jurisdictions. Pharmacists have seen their prescribing powers expand significantly. Currently, all pharmacists across Canada have some level of prescribing authority, but this varies by jurisdiction. More information can be found about the scope of practice if you scan the QR code on the screen. Pharmacists in Canada undergo comprehensive training both at undergraduate and postgraduate levels, with periodic certification renewals to maintain ongoing competency. This training ensures that they're well prepared to administer vaccinations safely and effectively. The introduction of pharmacy-led flu vaccination services in Canada led to a rapid increase in vaccination uptake, from 9,125 vaccines administered during the 2011-2012 season to nearly 80,000 in 2016-2017. Pharmacies have since become the primary location for influenza vaccinations among adults, surpassing doctors' offices with over 34% of adults receiving their flu vaccine at a pharmacy in 2017-2018. Additionally, one study found that 21% of high-risk individuals reported they would not have been vaccinated if community pharmacy services were not available. Now, let's take a look at France. Both pharmacists and pharmacy technicians are authorized to administer certain vaccines. However, pharmacists only have partial access to vaccination records. Pharmacy technicians are limited in the vaccines they can administer, as this is restricted to influenza and COVID-19 vaccines and only on a dispensing basis. Now let's hear more from the French Chamber of Pharmacists.
In France, pharmacists first started with flu vaccination, then was extended to COVID administration, and later on to all vaccines from the calendar, and in another step to prescribe those vaccines for all adults and as of children as of 11. The only exception is live vaccines for persons who are immunized compromised. The main purpose for pharmacists to vaccine is to reach persons who are either fragile, outside of the normal pathway of a patient who don't have access to general practitioner, for instance, but also persons who had never been vaccinated before. So that's the main interest for pharmacists to do all vaccines, prescribe, administer for the whole range of the population.
As we've heard from the selected vaccines explored, pharmacists in France can administer all vaccines to the population aged 11 years and over, with the exception of live attenuated vaccines for immunocompromised patients. Some other vaccines can be administered in liaison with the prescribing doctor for immunocompromised patients, including measles, mumps, rubella, MMR, BCG for tuberculosis, chickenpox, and zoster. Additionally, pharmacists can administer yellow fever in authorized centers and monkeypox in specific vaccination centers. Pharmacists in France can also prescribe all vaccines. They're required to complete mandatory training in vaccine administration at both undergraduate and postgraduate levels. This training, accredited by regulatory authorities, is provided by professional organizations and universities. It includes two key modules: vaccine prescribing and vaccine administration. The training ensures that pharmacists are well prepared to handle vaccination services effectively. Notably, there is currently no requirement for certification renewal, allowing pharmacists to focus on continual skill application rather than periodic recertification. Between January 2021 and 2023, over 26.3 million COVID-19 vaccines were administered by pharmacists. In January 2022, approximately 60% of COVID-19 vaccines were administered by pharmacists, compared to 25% by doctors and 15% by nurses. Patient satisfaction with the vaccination services provided by pharmacies was rated highly, with an average satisfaction score of 4.92 out of 5. Let's now explore the situation in Ireland. Only pharmacists are authorized to administer vaccines in pharmacies, and they have partial access to vaccination records. The vaccines administered by pharmacists include influenza, COVID-19, HPV, pneumococcal, and shingles. Pharmacists in Ireland can only prescribe influenza and COVID-19 vaccines. The Pharmaceutical Society of Ireland, PSI, oversees the regulation of pharmacy-based vaccination. Pharmacists must adhere to the standards and protocols set by the PSI, which include maintaining high levels of professional conduct and ensuring patient safety. Pharmacists are required to keep detailed records of all vaccinations administered, including patient consent, vaccine batch numbers, and any adverse reactions, which helps in monitoring vaccine safety and effectiveness. Postgraduate training is mandatory for pharmacists administering vaccines, and certification must be renewed regularly to ensure ongoing competency. Since 2011, pharmacists in Ireland have been authorized to administer vaccines, which has led to a 50% increase in flu vaccination rates and the administration of over 750,000 COVID-19 vaccines. Notably, 1 in 6 people vaccinated at community pharmacies had never been vaccinated before, illustrating the role of pharmacy-based vaccination in reaching new populations. Furthermore, 99% of patients indicated they would return for future vaccinations, and 93% rated the service at community pharmacies as 9 or 10 out of 10 for satisfaction. Now, let's move on to Portugal. Pharmacists and other healthcare professionals can administer vaccines in pharmacies, and pharmacists have partial access to vaccination records. Let's hear from our member organization, the National Association of Pharmacies, or ANF, to understand more about the situation in Portugal.
In Portugal, we are allowed to administer every vaccine that we are able to dispense in community pharmacies. So this means that we have around 20 vaccines that we can administer in pharmacies, but these have to be administered by having a prescription by a physician to be able to dispense and administer the vaccine. There is an exception for flu vaccines and for COVID vaccines. Since 2019, we are able to dispense and administer flu vaccinations in community pharmacies without prescription. And also, since last year's campaign in 2023, we are also able to dispense and administer COVID-19 vaccines without a prescription in community pharmacies.
As we've heard, pharmacists in Portugal can administer all selected vaccines. However, they can only prescribe influenza and COVID-19 vaccines. Similar to Ireland, Portugal focuses on postgraduate vaccination training, and certification must be renewed. Pharmacists must complete postgraduate training on vaccination and basic life support, certified by the Portuguese Pharmaceutical Society. Certification is renewed every 5 years, and pharmacists must demonstrate continued vaccination activity and complete refresher trainings. Currently, over 6,000 pharmacists are certified, and more than 2,500 pharmacies offer vaccination services. An example of impact, pharmacists in Portugal were responsible for administering 70% of all flu and COVID-19 vaccines during the 2022-2023 season, leading to a 32% increase in flu vaccination uptake. Let's now explore the situation in the UK. Pharmacists, pharmacy technicians, and other healthcare professionals can administer vaccines in pharmacies. Pharmacists have also partial access to vaccination records. From the selected vaccines explored, pharmacists can administer all of them. The range of vaccinations offered can vary depending on the pharmacist's qualification and the agreements in place with local health services. Pharmacists can also prescribe all of the selected vaccines. The level of integration between pharmacies and NHS vaccination programs is highest in England and is progressively being adopted in Wales, Scotland, and Northern Ireland. They're required to undergo both undergraduate and postgraduate training, focusing on vaccine administration, patient consultation, and emergency response. This training adheres to the national minimum standards and core curriculum for immunization training for registered healthcare practitioners. Certification must be renewed annually to ensure compliance with national standards and best practices. Pharmacists must complete specific training on vaccine storage, handling, and administration, as well as emergency response to adverse reactions. Although the core training is standardized across the UK, there can be regional variations in additional qualifications required. During the 2022-2023 flu season, community pharmacies in the UK delivered over 5 million flu vaccinations. NHS England also reported that over 1.7 million COVID-19 vaccines had been administered by community pharmacies as of March 2021. Community pharmacies across Northern Ireland, Scotland, and Wales played a crucial role in administering COVID-19 vaccines, contributing significantly to the national vaccination effort. Today, let's explore the situation in the United States. Similar to the UK, pharmacists, pharmacy technicians, and other healthcare professionals can administer vaccines in pharmacies. Pharmacists have also partial access to vaccination records. From the selected vaccines, pharmacists can administer all of them. All 50 states and the District of Columbia allow pharmacists to administer vaccines, though some states have restrictions on the scope of these authorities. More information, including a state-by-state overview of minimum age requirements for vaccine administration, is available by scanning the QR code on the screen. Pharmacists can also prescribe all of the selected vaccines, including influenza, COVID-19, pneumococcal, and RSV. They're required to undergo both undergraduate and postgraduate training, with no mandatory renewal for certification. According to the American Pharmacists Association, APHA, over 400,000 pharmacists, student pharmacists, and 100,000 pharmacy technicians are trained to administer vaccines, making them a crucial part of the vaccination workforce. Between December 2020 and January 2023, pharmacists administered more than 300 million COVID-19 vaccines, accounting for approximately 50% of all doses delivered. Pharmacists played an essential role in expanding vaccine access, particularly in rural and underserved areas. The FIP Pharmacy-Based Vaccination Surveillance Atlas is an open-access interactive tool, providing detailed data on pharmacy-based vaccination services around the world. You can explore country profiles, summaries, maps, and graphs based on FIP member contribution. Thank you for watching.